Hello, my name is Ann Walker, Health Educator for Copper Queen Community Hospital. This is the first of two videos that you will watch about utilizing restraints. This video covers Copper Queen's policy about restraints, and in the second video we will practice applying a wrist restraint and tying a quick release knot. So if you're ready, let's get started. All right, we're going to start with our policy statement. Restraints shall only be used when alternative methods are not sufficient to protect patients or others from injury. All patients will have an assessment performed to determine the safety and protective needs of the patient prior to the application of restraints or medical protective device. I'd like to go over when we use restraints. We use them only to protect the immediate physical safety of patients, staff, and others. Of course, we don't use restraints as a means of coercion, discipline, convenience, or staff retaliation. Use restraints only when less restrictive interventions are ineffective, and we'll go over some of those interventions shortly. Use the least restrictive form of restraint that protects the safety of the patient, staff, and others, and always remember to discontinue the restraint at the earliest possible time, regardless of when the order has the expiration time. A physical restraint is defined as any manual method or device attached or adjacent to the patient's body that cannot be easily moved and removed, and it restricts the movement of the patient. It also is not considered standard treatment for the patient's condition. A chemical restraint is a drug or medication used to manage a patient's behavior or restrict freedom of movement. And again, it is not a standard treatment or dosage for the patient's condition. With seclusion, a patient is held in a room involuntarily and prevented from leaving. This is found more often in emergency departments and psychiatric units. Typically, med-surg units don't have a seclusion room. Copper Queen ED does not use seclusion. Let's go over when to use a restraint. These are some helpful guidelines. The patient's current behavior determines if and when a restraint is needed. We're not looking at a history of violence or a previous fall to determine using a restraint now. The decision must be made on current thorough medical and a psychosocial assessment. And this is probably the most important. Addressing the issue that's underlying a patient's disruptive behavior often eliminates the need for a restraint. So the patient may be in pain, they may need to use the restroom, they may be hungry, and they may even be bored. And some of these things, if addressed, eliminate the bad behavior. What's very important is that if a decision is made to use a restraint, the least restrictive restraint is used. And we want to allow as much freedom and movement as we can, but still keep the patient safe, as well as staff and others. Examples of restraints from least restrictive to most restrictive are mitten restraints, and those just cover the hands. They would probably be used to prevent dislodgement of tubes and lines. Then we would go to wrist restraints. Those are also used to prevent dislodgement of tubes and lines and catheters. Next on the list would be a vest restraint, and this is sometimes used to prevent falls as well as disturbed violent behavior. Arm and leg restraints are used to prevent violent behavior. And then last, leather restraints. Those are also used to prevent violent behavior. Let's look at alternatives to restraints. This is probably the most important slide. So we are addressing more of the needs of the patient. We may need to do more frequent monitoring. A companion or sitter may help with the patient and their behavior. Distraction is always a great method. Music, reading, TV, anything that will distract them from the current situation. Providing frequent reminders about the importance of not touching their tubes and lines and catheters, keeping those tubes and catheters out of view, reorienting the person frequently, letting them know where they're at, what their name is, why they're here. Frequent reminders to the patient to call for help before getting out of their bed or chair. Using bed and chair alarms, those work very well. Placing the patient near the activity hub where there's nurses watching and staff that can keep an eye on them and monitor them. Keeping the patient away from triggers that might affect their behavior. And then stress management and relaxation techniques. Those, a massage or even giving them a bed bath may be helpful. It's important to know that use of restraints requires an order. The doctor's order is needed. Under extreme emergent situations, a registered nurse can initiate the emergency use of restraints, but the physician must evaluate the patient in person within an hour and write the order. This hospital does not use standing orders or PRN orders for restraints. The minimal components of an order should include the reason and rationale for the use of the restraint, type of restraint to be used, how long the restraint can be used, patient behaviors that necessitated the use of the restraint, and then any other instructions other than those required by the facility's policies and procedures. So non-behavioral restraints. These have to do with a patient who may be pulling at lines or tubes or removing equipment or dressings that are important to their care. They don't understand when someone is telling them not to do that. The order from the doctor will last as long as the restraints are in place, and it's important to monitor this kind of situation at a minimum of every 2 hours. Behavioral restraints have to do more when the patient is at imminent risk of harming himself or others. We use these restraints to manage violent or self-destructive behavior that jeopardizes the immediate physical safety of the patient, staff, or others. The monitoring for behavioral restraints is different than non-behavioral. Direct, continuous observation is required. In-person assessments must be documented at a minimum of every 10 to 15 minutes. The patient must be evaluated by a qualified nurse or provider at least every 4 hours for adults, 2 hours for children 9 to 17, and 1 hour for children under 9. If the RN assesses that the patient needs to continue with restraints after these time limits, the doctor must write a new order. However, the physician provider must conduct a face-to-face evaluation no less than every 24 hours prior to renewing a behavioral restraint. At that time, the provider shall reevaluate how well the treatment plan is working and try to identify ways to help the patient regain control. Components of care for a restrained patient. Vital signs are very important. Offering liquids and nutrition. Temporary release of the restraints for the purpose of caring for a patient's needs. This is at a minimum of every 2 hours, such as needing to toilet them, feed them, do range of motion. Turning and repositioning the individual. Skin care if the skin assessment indicates that they need care. Checking the circulatory status of the affected body part. Providing emotional, psychological support. And remember to modify the care plan. When somebody is put in restraints, it's necessary to modify the plan of care for that patient. All right, let's address removal of the restraints. A restraint can be discontinued or the level reduced by a nurse based on the patient's condition and the nursing assessment findings. This can also be done earlier than what the order's expiration time is. A temporary release that you would do if you needed to provide care, such as toileting or repositioning, is not considered a discontinuation of the restraints. Upon removal of the restraints, documentation must include completion of the restraint order. If the behaviors return and the patient needs to be restrained again, a new provider order is required. So at Copper Queen, I'm going to go over where you can document when somebody is placed in restraints. It is extremely important to document everything about restraints that we talked about. So check with your supervisor. There are places in Cerner that you can document somebody in restraints. And there also may be a separate form or checklist to be completed, and then we would scan that into the patient's chart. So if you're going to be monitoring the patient in restraints, you can open up the patient's file. You can go to Ad Hoc. Under Ad Hoc, you'll notice a heading that says Restraints. And that will bring up 3 separate documents that you can click on. The third one is Restraint Monitoring, Discontinue Violence Self-Destructive. And that would be the one that you would click on to document the monitoring you are doing with your patient. Once you click on the monitoring section, this is what will come up, and Restraint Monitoring is the title of this, and it will basically take you through everything that you need to document on the patient. Range of motion, circulation, reason for restraints, nutrition, all of the things that we identified as important. It will take you through to document on the patient. This concludes video 1 about Copper Queen's restraint policies. Our next video will show how to apply a wrist restraint.